An alarming new study shows Elmira, New York is ranked #1 when it comes to abused opioid prescriptions. WENY Samantha Potter spoke with a local doctor and drug counselor about the prescription abuse problem in our area and efforts to reduce the abuse. Samantha?
Yeah, Logan, the overall message from both the Guthrie doctor and the Trinity counselor I spoke to was intentions were good when the pills were handed out, but has now become a problem.
And I think we have a stigma here in Elmira where we have to drop that stigma and realize it's a problem. Obviously, it's a problem.
A study from a San Francisco healthcare system looked at areas with the largest opioid prescription abuse problems. Elmira ranked #1. For emergency room physician Jim Raftis, he says prescription opioid abuse is a problem that doesn't discriminate, from teenagers to retirees and from low-income people to upper class. And for how we got to this problem, he says it's difficult to point blame.
It's a difficulty for physicians because we have certainly a strong desire to try to help out patients in pain. And so we have to weigh that concern of patients that are having pain with the appropriate medications that we prescribe.
The study shows baby boomers are 4 times more likely to abuse opioids than millennials.
There's a lot of doctors that freely write scripts. You go in and you have pain, and they're going to write you a script. Obviously, someone my age is a baby boomer. I say I'm in pain, they're going to believe I'm in pain, and I'm going to get a prescription.
In New York and Pennsylvania, it's now required doctors use electronic prescriptions rather than paper to prevent a person from taking the prescription from pharmacy to pharmacy. Dr. Raftis says physicians are also moving towards alternative options when it comes to improving pain.
Maybe a pain pill is not the right way to go, but there may be physical therapy, there may be other modalities that we could use to try to help to limit their pain, improve their problem, and not be faced with using those kind of drugs.
LaRue says oftentimes she sees patients who want to get help but keep abusing because the withdrawals are so bad.
There's a stigma. You know, they don't want to be seen in a waiting room of an outpatient place that does addiction. But we're seeing more and more people are getting help, and we have to get the word out there that, yes, it's okay to get help, and yes, it's okay to get your life back.
Both Janet and Dr. Raftis agreed when used correctly, prescription drugs are helpful. It's when patients start to abuse them is when problems arise. If you're interested in seeing the opioid crisis study, you can go to our website, WENY.com. Reporting in the studio, Samantha Potter, WENY News.